Do you frequently feel like your heart is pounding after a simple walk? Or maybe you wake up with a sudden fever and body aches out of nowhere. It could be more than just tiredness. It might be the flu. Influenza, commonly known as the flu, is a powerful virus that attacks your nose, throat, and sometimes your lungs. Unlike a common cold that sneaks in slowly, the flu hits fast and hard. Imagine you were fine yesterday, but today you feel too weak to get out of bed. That's the flu's style. It spreads like wildfire, especially in winter, and can make school, work, or even family time a struggle. But don't worry, understanding it is the first step to beating it. Good question. The flu is caused by a group of viruses called influenza viruses. Think of them as tiny, invisible invaders that come in different types, mainly A, B, C, and D. Types A and B are the ones that cause seasonal flu outbreaks every. These viruses travel through the air when an infected person coughs, sneezes, or even talks. Picture this: someone in your classroom sneezes without covering their mouth, and within seconds, tiny droplets carrying the virus float in the air. If you breathe them in, chances are you'll get sick in 1 to 4 days. The virus can also live on surfaces like doorknobs or phones. Touch one and then rub your eyes or nose. Boom, infection. How do you know if it's the flu and not just a bad cold? Let's play detective. The flu often starts suddenly. 1 minute you're okay, the next you're shivering, even under blankets. Common signs include high fever over 100 degrees Fahrenheit, headache, muscle pain, extreme tiredness, dry cough, sore throat, and a runny or stuffy nose. Imagine your body feels like it got hit by a truck. That's flu fatigue. Kids might also get nausea or vomiting, which can be scary. But here's a clue. A cold usually starts with a sore throat or sneezing and builds slowly, while the flu charges in like a storm. If you've had all these symptoms at once, it's likely the flu, not just a cold. How do doctors know it's the flu? Sometimes they can guess just by your symptoms, especially during flu season. But to be sure, they might use a quick swab test, a cotton stick gently rubbed inside your nose. It takes only 15 minutes. Most people don't need medicines, but if you're at high risk, like having asthma or being over 65, your doctor might prescribe antiviral drugs like oseltamivir, Tamiflu. These don't kill the virus instantly, but they help you get better faster and avoid serious problems like pneumonia. Think of them as backup warriors. Rest, drinking fluids like warm soup or water, and staying home are super important. Ever tried pushing through work when you're this sick? It actually makes you sicker longer, so listen to your body and rest. Can we stop the flu before it starts? Yes, and the best shield is the flu shot. Every year, scientists predict which flu viruses will be common and make a vaccine to match. Getting vaccinated is like training your body's army, your immune system, to recognize the enemy before it attacks. It's like a fire drill for your body. Other smart habits: wash your hands with soap and water, sing happy birthday twice. Avoid touching your face. Cover your mouth when you cough, use your elbow, not your hand. And stay home when sick. Schools or offices using air purifiers or encouraging hand sanitizer. That's prevention in action. What's new in the fight against the flu? Scientists are working hard. One exciting advance is the development of a universal flu vaccine, a shot that could protect against many flu types for years, not just one season. That means no more yearly shots. Researchers are also using AI to predict which flu strains will spread, helping make better vaccines faster. Another cool thing, nasal spray vaccines are now an option for some people, which is great for kids who hate needles. Some studies even show that mRNA technology, the same used in some COVID-19 vaccines, might lead to stronger, faster flu vaccines. So, the future of flu protection is looking smarter and simpler.